Everybody, my name is Dr. Daniel Roney. I want to take this opportunity to welcome you to the webpage regarding sciatic pain or bulging disc or neck or low back pain. The video for these are going to be similar because they really all stem from a lot of the same causes and contributing factors. If you haven't looked on the welcome page and the video that's on there, please do so to give you a good idea and background of the big picture of how we like to treat things. Regarding these conditions, we see a lot of times, and this has been my experience throughout my last 10 to 15 years of treating low back pain and sciatic pain, neck pain, etc., is that a lot of times it's not an isolated situation, meaning there's other things going on that are also contributing to the back problems or neck problems or sciatic or what have you. Let me kind of clean that up a little bit. Some people come in, they only have a back problem, they're really healthy overall, and they just hurt their back, lifting something, bending, what have you. And so we treat it appropriately with just the treatments that I'm going to explain and the diagnosis that we're going to explain. Other people, though, with chronic problems and chronic back pain and chronic neck pain have other situations going on in their body with other systems of the body that are not working real well. So in general, they're not functioning real well, contributing to their back problems. Okay, so it's individually, when we do a history or exam, we need to determine those things. Is it just an isolated issue with the back or the neck, or are we talking about other issues, chronic problems, contributing to the neck or the back problems or the breakdown thereof? So again, just wanted to give you an insight there. But in general, when we're looking at treating sciatic or neck pain or back pain or what have you, the key is really a good examination. So we want to find out, number one, where the pain's coming from. Source of the pain could be everything from poor biomechanics, weak core posture, or weak core muscles or poor posture. It could be trauma that has been there in the past contributing to breakdown of the spine, etc. So we want to find out essentially where that pain is coming from. Once we find that out, our next step and approach is to schematically and strategically put a plan together in order to get that spine healthy again. Many times we'll see disc-related pain. Now, even though you don't have pain shooting down the arm or the leg, you may still have disc-related pain. And the best remedy probably on the planet, FDA approved, studies show year in and year out, it's one of the best modalities on the planet. We've had it in our clinic since at least 2002, is something called decompression therapy. And you can read about decompression therapy on the this website by clicking on decompression therapy. And basically what it does is it'll give you, allow a negative effect, a vacuum effect essentially in the center of the disc, and pull any material that's lying around the nerve root creating nerve pain away. And so that negative pressure is going to help you tremendously in getting an inflamed disc away from the nerve root. So we see this many, many times, whether it's neck pain or low back pain, that it's an inflamed disc that is the cause. So decompression therapy is one of the best remedies. Now, this is where, as I wrote on the web page, this is where the real work begins, because once you get pain relief, and again, we can't do therapy and do strengthening exercises and correct any structural abnormalities if the pain is there, if there's a disc sitting on the nerve. So one of the first things we want to do is get the disc off the nerve. Once that happens, and just as a caveat, this is why doing physical therapy first sometimes is, or a lot of times, is not a real good outcome, because you hurt worse, because the things that you're doing are contributing to inflaming the disc. So we want to get that disc calm down, get it away from the nerve roots. Decompression therapy is the first step in that process. So that's step one. Step two, we need to analyze you for poor biomechanics, poor alignment, poor structure, what have you. And again, I wrote this on the website, this is like a car out of alignment. If your car is out of alignment, your tires are going to wear prematurely, okay? And what's going to happen is, and if you don't fix the alignment, they're going to continue to wear prematurely. Even if you put new tires on, they're going to wear prematurely. So one of the things we want to do is correct any biomechanical or misalignment issues going on in the spine. There could be curves that aren't that have become deficient, meaning you've lost cervical curve or lumbar curves, no longer having good compressive forces distributed through that spine. You could have forward head carriages, etc. There's a lot of different deviations that could happen from just gravity over time, lack of maintenance to the muscles and the traumas. And if those misalignments are not corrected, it's like putting new tires on a misaligned car. It's just going to keep happening. So in order to get the stress and strain proper throughout the spine, whether it's the neck or the low back, to take pressure off of bones and discs and nerves and muscles and ligaments, we need to correct the biomechanics and the structure. Very simple, okay? Here at this office, we do a technique called chiropractic biophysics. We are able to take pre and post x-rays to show that those structural changes have taken place. One of only 3%, maybe a little bit more, of all healthcare providers trained in this technique. Very important. If you ever go anywhere to get alignment corrected, make sure they take pre and post x-rays to show the changes. If not, the manipulations are very, very good because you need movement through the joint in order to heal properly, which they're designed for, but it won't help get those things that I just talked about, forward head carriage, curves restored, etc. We need to do specific therapies in order to achieve that. So decompress, get the spine back into its normal biomechanical position, i.e. correct the alignment as good as we possibly can or as well as we possibly can. And then the next step in that phase of care is to strengthen. So most of you have most Americans in general, most people on the planet have very weak core muscles. The muscles that we're speaking of are the ones that really line the spine. So they're up against abutting the spine, and the stronger they are, the less work the discs, the bones, the muscles, the nerves have to do. So if we don't get the alignment straightened out and the muscles nice and strong, you're really not giving yourself a long-term outcome at all, meaning the pain will return again and again and again because these areas that are breaking down have no chance to heal, okay? If you have constant abnormal stress on them, they're not going to heal properly. You might feel better, but they're not going to be corrected, and that's the key to long-term success, is get the alignment right and then the muscle strong. The other thing that may happen, and you can read this on brain-based therapy link here on the left-hand side, is you may have an overfiring mesencephalon. So you chronic pain patients that have been in pain a long time, this is absolutely happening. The research is overwhelming. So we need to check for a high-firing mesencephalon, which is an area of your brain that, because of abnormal nerve input to certain areas like the cerebellum and the higher brain centers, other areas have to work overtime to compensate. And when that happens, you're going to get chronic pain and chronic problems as a result. So we really need to check those also. So again, whether you have neck pain, back pain, degenerative discs, sciatic pain, we really want to approach this from a very strategic, step-by-step approach. Again, if we did, and I mentioned this, if we did therapy first without getting the disc decompressed and off of the nerve and de-inflamed, it's going to hurt worse. So the right thing done at the right time will give you the right outcome. The right thing at the wrong time is going to give you the wrong outcome. It's still the wrong thing. Again, the right thing at the wrong time is still the wrong thing. Okay? So step by step, very strategic planning as to putting these things in place is going to create the best long-term outcome. So hopefully that makes sense. There's definitely more information that we have in regards to neck and low back and sciatic pain and disc degeneration, etc. We have a DVD that you could call Terry and get that, and we'll send that out to you to review that a little bit more in its entirety. Or if you call, or if you need to call and find out if you're a candidate to qualify for our program, you can also do that. So call 714-241-9355. Those numbers are all over the website here and at the bottom of this page also. So any more information, feel free to call. And I sincerely wish you the best, and I hope this was helpful. Okay? Thanks, and have a great day.